One thing I wanted to talk about uniquely today is injuries to the sacroiliac joint. Interestingly enough, about 25 to 35% of patients with back pain, the pain is actually coming from the sacroiliac joint. And these unfortunate patients often have treatment for the spine, for the discs and their facets, and they continue to have pain because the sacroiliac joint is the primary source of the pain, and it is so close to the facets and to the spine that it's difficult to distinguish. What I do with patients who have back pain, I examine them, and if the pain is in the right location and they have the appropriate positive orthopedic tests, then I will do what's called a diagnostic or therapeutic injection of the sacroiliac joint. I will put some numbing medicine, perhaps some steroids, into the sacroiliac joint under fluoroscopy, which is a motion X-ray. And if their pain gets better, at least 75 or 80%, then that would tell me that the pain is coming from that specific joint. Now, if that pain goes away and doesn't come back, then the patient is recovered and healed. If the pain comes back or is not fully gone away, and if the patient still has difficulties, then they may be a candidate for a sacroiliac fusion, which I do with a minimally invasive technique, utilizing an incision that's about 1 inch long. I have an example of a patient that I recently did a few days ago, a young lady who was in a car accident who injured her lower back. She had seen some physicians for pain management. She had had some treatment outside with physical therapy, rehabilitation, activity modification. She was given medications and ultimately some injections in her spine, and she continued to have pain. She came to me a few months ago, and when I examined her, I noticed that her pain was coming from her sacroiliac joint. After I did a confirmatory test of both sacroiliac joints, she had significant relief of her symptoms, and her pain essentially went away almost 100%. But once the medication wore off, her pain was slowly coming back, so we decided to do a sacroiliac fusion. So last week, I took her to the operating room, and through a small incision on the side of her hip and buttock area, about 1 inch long, I was able to fuse her sacroiliac joint with titanium screws. In her case, she needed both sides done, and it has now been less than a week, and she's already comfortable. She's not taking very much narcotics. I often tell my patients you're going to have a sore tush for a few weeks, and that should be the extent of the pain. Obviously, the first few days after surgery, you're going to have the surgical pain from the incision, but that goes away pretty quickly, and ultimately, the long-term success of this operation is significant.